Do you know that every antibiotic you take for every little infection could be quietly killing your mental health? I know you do know this. But in today's video, we are talking about how antibiotics can increase depression rate and why it's so important to pay attention to the hidden impacts they have on your mental health. Nobody will tell you this, but I'm here to share what I've learned. Antibiotics are one of the most commonly prescribed medication worldwide, whether it's for simple infection or something more serious. We take them every time. Some even self-medicate themselves with these antibiotics. Nobody prescribes it, but they will buy it because they feel like they need antibiotics. So many misuse. So to get better, we keep using this thing. But what if I tell you that taking antibiotics could mess with your mental health? Some people even use it for cold, catarrh, or something more serious. We take them to get better. But what if I tell you that taking antibiotics could mess up your mental health? Research shows the link between the use and an increased risk of depression. So let me start with the link between antibiotics and gut health. So understand how antibiotics affect our mind. We need to first talk about the gut health. We might be thinking that what does my gut health have to do with my depression? Well, the gut and the brain are closely connected through the gut brain axis. We all understand when somebody tells us that my gut tell me you are a good person. What do they mean by the gut, as in the English word? Your gut produces a large percentage of serotonin in your body, which plays a huge role in regulating your mood towards something, towards what you're currently doing. Antibiotics wipes out the good bacteria, and this can affect serotonin level, making it harder for our brain to maintain positive mood. But it does not end there. Research finds that the imbalance in gut bacteria can also cause inflammation in the brain, from your stomach to your brain. This inflammation can disrupt the production of neurotransmitter like dopamine, happy hormone, serotonin, balancing hormone, which are vital for your mood and overall wellness. This leads to an increase in depression symptoms. Those that have just symptoms before, it can aggravate it and even make it worse, and could even trigger anxiety and other mood disorder. The amount of antibiotics they give you to treat a particular infection is called a course of antibiotics. So research shows that 25% risks of depression after a course of antibiotics, 48% after 2 courses of antibiotics within 12 months. Now imagine somebody that used more than 10 courses of antibiotics in a year. How are you going to cope? So the higher the antibiotics you took, the higher the risks of depression and anxiety you can face later. As a nurse, I've been learning more about how this medication impacts not only physical health, but mental well-being. Do not get me wrong. Antibiotics are important to help your physical health, but let's be aware of their side effects. That is why I feel it's more important to raise awareness about these impacts. So, what can you do about it if you find yourself in this situation to use antibiotics? First, don't stop taking your antibiotics if your doctor prescribed them. They are important for treating infection, but make sure you are supporting your gut health while taking them. Eat foods that will promote your gut health, such as probiotics, prebiotics, and fiber. Also, after completing your antibiotics, consider eating these probiotic food and supplement to help you restore your balance. For an instance, when they prescribe antibiotics and anti-malaria for you in the hospital, they will tell you to use it with yogurt. Why they advise you to use it with yogurt is not because blood level is going to be low. No. The reason they tell you to use yogurt, to use these drugs, is to place the bacteria in your gut. So these yogurts have the natural bacteria that will place bacteria in your gut. So that is the reason, which is very good. So all these little tips are there for you, but you never ask a question, right? So I'm here to enlighten you on all those little tips that you have been getting, but no one to explain. You can also talk to your doctor about alternative taking antibiotics alongside the probiotics that can reduce the mental health side effects. Don't hesitate to reach out if you feel like your mental health is being affected. Remember, your mental health is just as important as physical health. Always listen to your body. I would love to hear from you. Drop a comment below And don't forget to subscribe for more health tips.
And don't forget to share this video with your friend who use Flagy for diarrhea.
And always remember, your health matters in and out.